Good morning, everyone. Thanks for joining us this morning. I think we have a fairly small but select group with us today, so thanks very much. I hope you're going to enjoy this session. So this is the first session of our Science and Health Live 2022 event. And my name is Karen Edwards and I'm Engagement Officer at the School of Medicine. So I'm going to be presenting this first session, which is Guess the Healthcare Professional. So we've set up this session to have an hour of sort of fun and interaction, and just to highlight the breadth of healthcare professional roles that are vital in the NHS today. And I'm delighted to say that we've got 4 professionals working in different occupations, and your job today will be to try and guess the right profession for each of our guests. So each guest will inform you of the A levels or what they studied at 6th form, and then they're going to do a short mime on an aspect of their job. So I'm hoping while they're doing this that you'll be putting some questions forward. If you can type them into the Q&A function to start trying to guess or ask questions, you know, that our guests can answer to give you an idea. But the questions must be that they can just answer yes or no to. So I will ask them the top 4 questions that come through, and then after this you'll have the opportunity to guess what the healthcare profession is from a list of possibilities that we're going to use on Mentimeter. So I hope that you each have a separate device to hand so that you can take part in our live voting on your mobile phone if you have that with you. Okay, so we'll make a start, and we're going to start first with Tom this morning. So Tom, if you can join us. Great. Morning, Tom. Thanks for being here.
Morning.
So if I can ask you first of all, what you studied at 6th form. I believe you didn't do A levels, is that correct?
No, I did the International Baccalaureate, of which you have higher and lower levels. And at higher level, I studied physics, geography, and English. At lower level, I studied maths, peace and conflict studies, and Spanish. And then also did theory of knowledge as well, alongside that.
Okay, sounds very interesting, very varied. Great, okay, so can you give us a quick mime of your role?
Oh, quick mime.
Great, okay, so you guys in the audience, you can type into the Q&A any questions that you might have to try and work out Tom's role. While we're waiting for some questions to come in, I've got a couple of questions here to start us off. So do you work directly with patients, Tom?
Yeah, directly patient.
Yeah. And is your work office-based?
I have a number of roles. Some of it's office-based, some of it's not.
Okay. And is your role 24/7?
Yeah, it's 24/7.
Okay. And are you based in a hospital?
Not based in a hospital directly, but I do work within the hospital when I need to.
Okay. Well, no questions have come in, unfortunately. I don't know if we've got an issue with people able to access the Q&A function. So what we will do is hopefully people will be able to have their devices to hand to be able to have a go at voting to try and guess your profession. So if you just bear with me a second, I shall share my screen here. Okay. So people out there, if you have a device, then you're able to go to menti.com and insert the code there, which is 91846026. And then we're going to ask you to vote as to what profession you might think Tom does. Okay. Okay. This is not going so well. Ah, hooray, hooray.
There's 5 attendees at the moment that I can see online.
Oh, okay.
Mike Philippa, Mrs. A, Tyler West, and Martin Blavey. So,
okay. I know a couple of those are teachers who have a group of pupils with them. So I'm hoping that the pupils will be able to perhaps use their phones to be able to vote. But we do have 2 votes, so oh, and another vote. Okay. Oh, they're very varied. So we've got a vote for radiographer, psychologist, critical care practitioner, and a GP. So I think, oh, more coming through. Great. Okay. So a lot of people are thinking you're a critical care practitioner. So I think at this point, Tom, I shall ask you to reveal your profession.
I am indeed a critical care practitioner with the Wales Air Ambulance and EMRTS.
Great. Okay, thank you. So I'm going to stop sharing my screen for the moment. And, Tom, perhaps you'd like to tell us a little bit more about your role and what that entails.
Yeah, so I'm probably one of 3 of the longest serving on the Wales Air Ambulance as a clinician. I'm a paramedic by background, so I spent beginning my career in North East London, and then came back to Wales, which is where I'm from. Even though I don't have that accent anymore, I've lost it unfortunately in London. And so my role entails a lot of different things. We're probably best described as a jack of all trades and a kind of master of none. So we're expected to look after from kind of neonates all the way through to kind of geriatrics and the specialist care that involves in terms of critical care. And that can be from retrieval medicine, so flying to Bangor to retrieve somebody back to Stoke, which is the trauma centre there, or to specialist neurocare in Liverpool. It can involve direct to scene, which is predominantly the majority of our work, which is kind of primary pre-hospital care. So RTCs, cardiac arrests, the scale whereby a lot of the people that we'll deal with will be intubated, ventilated by us, have specialist procedures if they need surgical intervention. We carry blood, and we have the ability then to take them to centralised care, such as Cardiff is the major trauma centre, or Stoke in the north. So we cover a kind of range of different areas. On top of that, you've got to be a technical crew member, so you have to have the aviation side of things and learn about that. You have to have advanced driving, so you can drive on blue lights. So we really do cover a kind of broad range of things. And then with Cardiff University, I lecture for postgraduate critical care with the School of Medicine. So teaching that next generation to kind of come through and use research and evidence-based medicine. And that's great because it's same as our team, multidisciplinary. So I've got kind of students who are consultants in emergency medicine on the course. I've got students who are from nursing ITU background, some primary care background, dietitians, physiotherapists even who work in critical care on the ITU, and some pre-hospital. and that's also with Cardiff University because it's online. It's an international basis, so it's really quite interesting getting perspectives from Canada, from Africa, from Singapore, from Middle East in Qatar. So it's quite a very broad background, I think, is probably best described for what we do.
Great. So what would you say is the best bit about your role?
I think I probably have one of the best offices in Wales for when I am flying. It's quite nice to, sometimes when it's grey and dismal like it is today, looking out the window, if the cloud base is low, we punch above it and it's blue skies and sunshine. And again, you know, you get to fly into places like Barafundle Bay, kind of in West Wales, which almost looks like you're flying into a tropical beach during the summertime. So yeah, that's definitely one of the perks of the job.
Yeah. Great. What about the worst aspect? What do you say, if there is one?
There's lots of things. I mean, we have the privilege to walk into people's lives probably on the worst day that they're having, and that can't necessarily always be easy. And at the same time, I've just finished a night shift, so I'm fairly tired at the moment. I finished at 7 and didn't leave work until 8. So it's certainly kind of long hours. But I think the benefits and the positives far outweigh some of the kind of negatives of our career paths as we've taken them.
So what would you say are the key skills or attributes that someone would need to do your job?
We have quite a rigorous selection process from all backgrounds. So we have consultants who are on board the aircraft, from intensive care, from emergency medicine, from anaesthetics, CCPs we take from paramedic background, from nursing background, and we've got the kind of physical tests, because you're expected to obviously go up into different environments, whether it be in the mountains or whether it be in homes or whether it be in the valleys, carrying quite significant kind of weight. So you've got that element. But I think that the main one that we look for is that competency, but a sense of humility as well. We really select off the kind of personal attributes in terms of people who are comfortable working in what we call a flattened hierarchy. So it's a team approach. So you've definitely got to be a team player to work in our environment, and be humble at it as well. So, you know, if we're looking at selection processes, one of the vetoes for selecting coming into our unit, no matter who you are, you'll be selected over a number of days. But, you know, we've known people who've not got into our unit because if they're, what I would say is kind of off, say, with just the administration kind of team who are running that selection process. So they may come to us and try and show how great they are on all the other bits and pieces. But if they're rude to one of our admin team, that kind of tells us and starts to tell us about the type of person they may be. And that'd be flagged fairly quickly. So there's almost a veto on, you could be the best kind of surgical skills person, you know, have the best education, but if you're not the right personality to fit into our team, then that will kind of flag fairly quickly. So I guess that's some of the kind of key aspects. It's the human factors and non-technical skills that we like to see come through. So you can read a book, that's great. You're not master of that kind of art or kind of science. You've got that emotional learning curve. So we kind of pick people who've got a kind of broad background and experience as well to be able to deal with the team, but importantly the patients that we deal with. That's a big factor.
Okay, right. I'm not sure if anyone's got any questions for Tom. If you want to type anything into the Q&A. Oh, somebody's asked how many are in your team.
Good question. I probably don't know anymore. So being one of the longest standing, we used to have a team of us who are based in Swansea. We've got 4 aircraft in Wales. Previously we had 3, and previously the teams were quite small, so you'd have 6 members of staff to each aircraft. that has now gone to around about 40 CCPs and probably 70 doctors, because we've got a number of training posts, fellowships, an extra third seat that we use for development purposes. And so it's an ever expanding empire. We've also now got a team called ACTS, which is the non-time critical but critical care transfer service. So they're road based. Again, that's expanded. And how things go in the future, I'm not too sure, but there's elements of when we centralise care, which we know is the, in terms of the evidence base, if you have a heart attack, then you want to go to what we call a cath lab to be able to take angiography, etc. If you have severe trauma, then you want to come to a centre which has got the best trauma care possible, interventional radiology. We transfer out of Wales as well. So if you have a clot in your brain from a stroke and you need thrombectomy, then you'd be taken to Bristol. If you need to be, the next stage in ITU care would be ECMO, so extracorporeal oxygen, oxygenation, membrane oxygenation. Then that's done in London, so you'd be transferred to London. So those kind of requirements require a broadening of kind of what we do, and we've gone 24 hours now, so we've got that ability to cover all of Wales, but that's just one aircraft at the moment from Cardiff. So kind of like I was working last night, if needs be, I can fly up to North Wales, and if the patient's taken to Bangor, then we then may retrieve them from Bangor to Stoke. So a long-winded question of how many there are of us. But I imagine that there will be more in the future as well.
Tying in from that, somebody's also asked, what's the furthest you've had to travel for an emergency?
For an emergency, probably North Wales for a primary tasking. In terms of retrieval medicine, for what our service does commissioning wise, then to Ireland, up to Scotland, up to Newcastle. That's not uncommon if you're looking at some of the specialist kind of care that we may kind of be taking a patient to or from, or repatriation. So fairly long distances, but I've had the fortune to be able to work abroad as well, and some of those kind of distances are far in excess of what we do in Wales.
Just out of interest, how long does it take you to fly to North Wales from Cardiff, say?
Probably takes us about 45 minutes.
Okay.
And if the wind direction's in our favour, then that can be shorter or can be longer.
Yeah. Okay. And somebody else, Harris, has asked, what's the hardest part of your job? I know we kind of touched on what you felt was the worst part.
I mean, it can be a difficult environment. You're dealing with some of the sickest patients from both trauma or both from kind of medical kind of background. And again, that's how we select our members of staff, is to be able to work in an environment whereby it's not just the kind of academic clinical side of things, it's also the kind of mental health awareness side of things. So we do deal with some quite testing situations, but we have a lot of support mechanisms in place. We work with some really good charities. To Wish Upon a Star is one of those in terms of bereavement charities, and we've got a very good relationship with them. So we're very fortunate to have that kind of backup for members of staff if they wish to have it available to them. So yeah, that can definitely be difficult, because it's not an ordinary daytime job. It's kind of filled with different things and almost bring calm to chaos in some respects, from major RTCs or significant events which are in the news quite frequently. Certainly on a weekly basis, you'll see things in the news that have our involvement in them. So I guess that's possibly one of them. But at the same time, we do have that support, which is great.
Great. Okay. Well, thank you very much, Tom. Thanks for joining us at the end of a very long night shift. So we'll let you get off now and get some rest. But thank you very much.
No, thank you for inviting me back again. And yeah, I should be off to bed now.
Okay. Good night, Tom.
Take care.
Thanks. Okay. So next then, we're going to go to Lisa. So Lisa, would you like to join us?
Hi there, good
Hi,
morning.
Lisa. Hi. Thanks for being here today. Just firstly, can we ask you what A-levels you studied, Lisa?
Yeah, so I did 3 A-levels. I did chemistry, physics and maths.
And again, if we can ask you to do us a mime of what your role entails.
Okay, fine. So there you go.
Great.
Not the easiest job to mime. Right.
No. Okay, so to put some questions to Lisa to try and identify what her role is. Martin, which I'm not sure was for Tom, but I will ask Lisa. Apart from your professional qualifications and skills, what would you say are the 3 most important qualities necessary for your work?
Oh, interesting. So I would say that curiosity is one.
Yeah.
I'd say the ability to work with people from all sorts of different backgrounds and with different skills is a second one. And I think a third one is probably persistence. The work I do involves needing to overcome a lot of obstacles to be able to get to the right answer.
Great, thanks, Lisa. Okay, so another question, do you work in a team or as an individual?
Yeah, that's a good question. We do a bit of both, actually. So a lot of the projects that I work on are team-based, and it's absolutely essential for those that we have a team working with us, because we need people with lots of different skills to be able to get that work done. However, there are things that I also do on my own. So we do a bit of both, which is actually quite nice about the role.
Okay. No more questions have come in as yet, so perhaps I can ask you, do you work in an office?
Yes, I do. I would say that most of my work is probably office-based, but with lots of opportunities to go out and meet people, meet students, meet different people from lots of different settings, lots of different countries. So yes, mainly office-based, but I don't sit at a desk all day, every day.
Okay. Another question's just come in. How long did it take you to train for what you do?
Oh, that's a good question. So I did not take a direct route, I would say. So I may not be typical of everybody. However, there are opportunities to come into this role from lots of different other roles. So in total, if I'm just thinking about my training, so time spent on formal courses, that would be 9 years. But then there's also sort of additional learning that I've done along the way that's contributed to the work that I do now as well.
Okay, gosh, 9 years, that sounds like a long time.
9 years, but in chunks.
Yeah.
So you do a bit, then you work for a bit, then you go back and do a bit more training, then you come back to work. So not all in one go.
Okay, so if there's no more questions, I think once again we will take it to the vote. Okay, so let's move on to, okay, so do you think Lisa is one of these professions? If you can vote again. Got one vote for physio, one for radiographer. Got somebody voting for hospital pharmacist. A couple of votes for epidemiologist. 3 votes for radiographer, interestingly. Okay, so I'm going to ask Lisa to reveal what her profession is.
I am, in fact, an epidemiologist.
Great. Well done to you two for guessing that. It's not the easiest role to guess.
It's not, and pre-pandemic, I don't think anybody had ever heard of us. I kept being asked whether or not I worked with skin diseases, I think because epidermis is a part of your skin, and so that was the word that was closest. Since COVID, our role has become a little bit more known.
Yeah, okay. Perhaps you'd like to tell us a bit more about your role, Lisa.
Yeah, absolutely. So epidemiology is the study of the health of populations. So in my mime, what I was doing was counting, because that's what we mainly do. We count people, we count exposures to things, we count outcomes, and then we try and link those things together to be able to develop good policies for health. So I spend my time reviewing evidence, seeing what evidence is already out there. Then when we identify gaps in the evidence, we try to do new studies ourselves. That involves having to obtain funding for those studies, designing them, conducting them, and analysing them. And then after we've done those studies, we have to communicate our results. And that involves either discussing these with people in government, people who are practicing. So, for example, sometimes our results are relevant to clinicians. And also our role involves working with other people in order to get those studies done and disseminated. And that can again be a whole load of different people, from clinicians, government ministers, all the way to members of the public, who we also involve in our research now almost invariably.
So I know you've mentioned that you've done a lot of training, but what is the actual training that would be required for your role? So
a bit like Tom was saying, the people come into epidemiology from lots of different backgrounds. So my particular background is in medicine. So I did a degree in medicine first. I then did an MSc in epidemiology, followed by a PhD, which was 9 years. However, in the unit where I work, we have people who've come from a maths background, people who've come from a psychology background, people who've come from completely different backgrounds. So, for example, some people have worked in the charity sector for some years and then come into epidemiology. So you can certainly come in from lots of different backgrounds. What would happen usually, though, is that people would then do a postgraduate training program. So everyone is a graduate, and then people will do a postgraduate training program. So, for example, there's a specialty training program in public health that people can do. And you can do that if you have a medical background or not. Or people may do what I did and do a master's and then a PhD and then end up in an academic institution. More and more, we are also accepting people with data science kind of backgrounds, because big data and using data is becoming more and more of the role. So that's another way that people come in, is sort of through more of a computing, maths, data science kind of background. So all kinds of different routes in and training that is helpful.
Must make up a very interesting team then that you've
it's
got.
really it's brilliant, and you need all those different people actually, because you need those different skills in order to be able to carry out what are really complicated projects often. So you need a whole range of different people to be able to do that successfully.
Okay, I mean, if I can ask you, as I asked Tom, you know, what's the best bit about your role, would you say?
So I love answering, feeling like I'm answering important questions that are going to make a difference. So I think that's a big bit. So when you get those results and you're able to answer a particular research question, that's absolutely fantastic. I think there's a real variety in the things that I do. And I think that's very interesting and exciting. No day is the same for me. I think it's great that we can be flexible in the things that we do. So I haven't taken a straight route, because I've constantly been pulled off to do interesting things in other directions, which is why I've taken a bit more of a winding path. As you've mentioned already, I get to work with amazing, interesting people from all over the world. And that also means that I get to travel, not so much recently, but pre-pandemic, I traveled a lot. I've actually lived in Bangladesh, I've lived in Ghana, and I've spent shorter periods of time in lots of different places. I also do teaching like Tom does. And I think that's a really important and enjoyable part of my role as well. I teach the medical students, I teach public health trainees, and I teach master's students as well. So a whole range of different people, and that's a great part of my job, I think.
Yeah, that's great. So what would you say is the worst bit of your job?
So I think working with data can be frustrating and a bit annoying sometimes. People are inconsistent in what they do and in what they report to us, and we have to try and get to the bottom of that, and that can sometimes be a bit frustrating. We also spend a lot of time trying to gain permission to get access to certain data sources, and that can drive you around the bend, because that can be quite a bureaucratic process. One of the other frustrating things for me, I think, is that there's often too many interesting questions to try to answer. So having to try to limit yourself to just a few can be a bit annoying sometimes. And also, because we are so reliant on external funding for our work, we have to get used to a lot of rejection, because these funding panels are incredibly competitive, and so you have to get used to rejection and always have a plan B to know what you're going to do next if your first attempt isn't successful. So I guess they're the worst things.
Yeah. Okay. So we've got a question in from Martin. What's the focus of your work at the present time? Are you mainly concerned with health issues in Wales?
Oh, that's a really nice question, actually. So I'm mainly a maternal and child health epidemiologist. And in my previous work, I mainly looked at maternal and child health in low resource settings, which is why I spent time in Bangladesh and Ghana working on various projects. I moved to Cardiff to work in 2013, and now I do a combination of the two. So I still have some work that's going on in low resource settings, but I also now look at maternal and child health in the UK, and I'm particularly interested in autism and in trying to improve access to services for autistic children. So they're the main things I'm focusing on at the moment. but all sorts of projects and plans come across my desk.
Okay. No other questions have appeared, but is there anything else that you'd like to say, Lisa? Have you missed anything?
No, I don't think so. I mean, I think other than to say, I think the pandemic has shown us the value of epidemiological research. We are only where we are today with the pandemic because of all of the amazing research that happened at great speed. And it's been a really exciting time to be an epidemiologist and working in public health for that reason. And I think that work will continue, and we will need more people in public health in order to be able to both recover from the pandemic, but also make sure that we are prepared for the next one, because another one is probably coming. So it's definitely a profession, I think, that will be looking to increase capacity. So if people are interested, I think it's a good profession to consider at this particular point in time.
Okay, we've got a question from Caris. What would you say is the biggest issue that you've researched so far?
Oh, that's interesting. So the study that I was working on in Ghana is probably the one that sort of affected me most emotionally, I think, because that was looking at ways to reduce deaths during pregnancy and in early childhood. And although we are very fortunate now in the UK that those deaths are very rare, in many locations across the world, particularly because they don't have good access to medical services, those deaths are still horrifically common. So I think that is probably the area that affected me most personally. Because it felt like if we could find answers there, we would really make a big difference.
Yeah, that's huge, isn't it, really?
Yeah.
Okay, great. Thank you very much, Lisa.
Brilliant. Pleasure. Thank you.
Thanks a lot.
Bye.
Bye. Okay, so we should move on to Emma next. So Emma, if you could join us.
There we go. There we go.
Hi, Emma.
Hi.
Right, if I can just ask you then, first of all, can you let us know what A-levels you studied, please?
Okay, so I did maths, chemistry and biology at A-level, and I also did art at AS.
Okay. Right, and then if you can show us your mind for your an aspect of your profession.
Okay, I'll probably send the profession back decades, but it'll be easy enough to get, I think. Right, okay, so we've got... Okay, small one and short.
Okay, great. If people would like to put some questions to Emma, something will come through now. In the meantime, I shall ask you,
Go for it.
do you work in a lab?
I don't, but some of us do.
Okay. We've got a question come in. Do you work in a hospital environment?
Yes.
Yeah. Okie doke. Do we have any more questions? What was your route to your job?
Okay.
I've given it away.
To say I've given a lot away, I would say quite a bit of education.
Yeah. Did you have a degree that was relevant to what you're doing?
Yes.
Yeah. Okay. Someone else has asked, do you work directly with patients?
Yes.
Yes. What age group do you primarily work with?
All ages.
Okay. Someone else has asked, do you operate? I guess they mean, do you operate on people?
No. Nope.
Does your work involve research?
Yes, some of us.
Okay. Okay. I think then we shall go and see if we have enough information for people to have a guess at what you do. So, do we think Emma is which one of these professions? Okay, no. We've got 2 for hospital, 3 for hospital pharmacist. We've got a physiotherapist or a paediatrician. Okay. More votes coming in for hospital pharmacist. So Emma, would you like to reveal what your profession is?
Yep, there's 5 people, all right. I am a hospital pharmacist.
Great. Well done, guys. Okay, so perhaps you'd like to tell us a bit more about that, Emma, and what that involves.
Of course. So specifically for me, I work in a busy teaching hospital, but there are obviously your local community pharmacies like Boots, Lloyd's, Well, things like that. We also work in the community, in the industry. So I'll talk specifically though about hospitals. So right now, it's obviously a very busy environment with the ongoing pandemic. But generally speaking, we normally have a couple of wards to do per day. So for instance, today I'm covering the care of the elderly ward. So normally we'll go and just see who our new patients are, speak to them and do what we call a medicines reconciliation, which basically looks at checking what medications are they taking at home and making sure that that's appropriately prescribed whilst they're in hospital, as well as checking doses and interactions of any new medication that's prescribed to treat their sort of acute illness. We obviously, when they're deemed medically fit, we will also process their discharge medication and communicate all that information to the GP so they can actually carry on with that supply then in the community. Normally as well, we will be rotated in to cover what we call the main dispensary, and that typically involves kind of clinically checking prescriptions that patients receive from places like A&E, any outpatient clinics. So for example, in Morriston, we have cystic fibrosis clinics, we have a lot of respiratory clinics, and we look at things like TIA, which is basically a mini stroke. Some of us as well are very into sort of education and training. So we have our foundation training pre-regs effectively, and our diploma pharmacists, as well as kind of training of other healthcare professionals. We've even got pharmacists as well who specialises in clinical trials. So quite a diverse team.
Yeah, okay. Great. Well, I've just got a couple more questions for you, but if anybody would like to put some questions to Emma, please just type them into the Q&A. So what would you say is the best bit about your role, Emma?
Okay, I definitely say there's a variety of job opportunities. So that was really important for me when I was looking at uni. So for example, it's not just the conventional, you work in a community pharmacy like Boots, or you work in a hospital. We are starting to kind of diversify, and you can do academia. So I've done a PhD, so I'm going down the academic route. You can go down the industry route where all the big bucks are. And obviously we're now starting to have pharmacists in primary care where they're making quite a big impact and helping take some of the strain off the GPs. A lot of my colleagues as well have gone into like pharmacy law, and we even have pharmacists working in NASA. So there's a lot of opportunities. I'd also say the role itself is expanding. We're getting a lot more kind of put on our shoulders, so we can now become independent prescribers and specialize in kind of a niche area. So a lot of my colleagues have done, for example, specializing in hematology, so looking at the blood and running clinics on patients who have confirmed or suspected clots somewhere in the body. And I'd also say job satisfaction, and be under no illusion, it's not all sunshine and rainbows. And you do see some horrendous things sometimes, but you also get the alternative where you get some really great patients, and it's lovely to see them at the end actually leave the hospital well.
On the flip side of that, what's the worst bit about your role?
I'd probably say I can list 3. So I'd say Dr. Google, or I think the term now is cyberchondria. I try and encourage patients to learn as much as they can about their health conditions, because more information, you can kind of handle their condition a lot better. But there's a lot of misinformation out there which can lead to a lot of stress and anxiety, and we get a lot of questions on the phone sometimes regarding certain medications. I'd also say maybe the one which probably irks me the most is the public perception of pharmacy. More often than not, when I see a patient who's waiting for a prescription and they start to get quite angry, and it's usually, oh, how long does it take to pick a box of tablets off a shelf? It's kind of like this general kind of sort of ignorance kind of extends to the wider general public, and also sometimes the government level. And it's not a case of we're picking a tablet off the shelf. It's kind of the check that goes on before that to check that it's okay for you, it's okay for your kidney function, your liver function, the other medications you're on. And also, for example, seemingly harmless antibiotics, for example, something like ciprofloxacin, is fine for the general population, but if anybody's got epilepsy, you really shouldn't be using that, because it can increase your risk of seizures. So I think that a lot of work needs to be done to kind of educate people on what we actually do. And I'd say probably the one which looms over us the most is that there aren't really any second chances in pharmacy. You know, if you make an error, that can have some very serious consequences. So I'd say those are the 3 key ones.
Okay, great. So what would you say are the key skills or attributes that someone would need to be a pharmacist?
Well, there's quite a few. I'd say probably the first one I'd probably say is probably attention to detail. It may seem a little bit extreme, but obviously we're dealing with medications which could, obviously the dose is wrong or interacts with another medication, you can have some kind of life-threatening outcomes. So you do need to kind of be on all the time and just make sure that you're basically accurate in everything that you do. I'd also say being able to multitask or prioritize is a key one. Particularly, for example, in our dispensary, you might have to deal with situations where you've got a prescription to clinically check, and somebody's been waiting about 10 minutes, the phone is going, you've got to get meds up to the ward, you've got staff coming to say, oh, you know, you've got a patient who's worried about her newborn, and also she's brought in 2 crying toddlers. So you've got to be able to kind of prioritize all those tasks. And I'd say the other probably key one is communication. It's absolutely integral to the role. You need to tailor your communication to who you're kind of speaking to. So for example, if I'm on the cardiac ward and somebody's got a supraventricular tachycardia, the doctors are going to understand that, but speaking to the patient, you just need to tell them that your heart is suddenly beating a lot faster. So you need to be able to kind of communicate at all levels. So I'd say those are the top 3.
Yeah, okay. We've got a question from Martin saying, so why pharmacy? So why did you choose pharmacy?
That was a university interview question for me. To be honest, for me personally, I kind of wanted to go to uni, but I wanted to make sure that the qualification coming out of it was actually useful to kind of my future career. So pharmacy seemed like a good bet. You can kind of, whilst I completely respect what doctors do, it is, bless them, a very tiring job with very long hours. Pharmacy, you know, you've worked 12 hours, or for example, in hospital here, we work 9 till 5. So you can kind of, you have that break between your work-life balance, which was very important to me. But you are also having an impact on patient care. And for me as well, I knew I wanted to go down kind of like the science kind of research route. So this kind of degree allowed me to do that as well.
Caris has asked, what's the most interesting part of your job, do you find?
It's a very good question. We all kind of have our own kind of niches. So when we do the 4-year degree, and you have to do the foundation training year and then take an exam at the end of that set by our governing body, and then you're a qualified pharmacist. But after that, you will do the diploma and you can then specialize in an area that interests you. So for me in particular, I've done a PhD and I kind of went down the research route. So I'm really interested in the heart. And sort of my PhD looked at looking at a new type of sensor to monitor the heart really whilst people are out and about their daily lives, because we are starting to see devices like the Fitbit and the Apple Watch can record ECGs. And we've had one patient coming in because her husband was a GP and saw the trace and was like, right, we're going off to A&E. So that's kind of my area of interest.
That's probably the future to some extent, isn't it? Yeah. So question from Martin, how important is chemistry to your role?
Oh, I say definitely usually they ask for biology and chemistry, at least one of each for admissions to university. And it is very helpful for the degree itself because we do have specific chemistry modules, and you are looking at things like carbon chains and kind of the structures and electrons and all that jazz. But when you kind of become a pharmacist, it's not as important. You need to have that general awareness, particularly when it comes to drug structures. Somebody, particularly with penicillin allergies, are allergic to the basic penicillin structure. So no matter what tweaks they will make, somebody's always allergic to that. So I would strongly suggest chemistry is a good way to go for A levels, because it will make your life a lot easier if you want to go down the pharmacy route.
Great. Okay, thanks very much, Emma. That was really helpful. Hopefully people have learned a little bit more about pharmacy now. So,
No problem.
Thanks for your input today.
No problem at all. Thank you for inviting me.
Oh, thank you. Okay, so we have Martin next.
Hello. Hi, Karen. Hi, everybody.
Hi. So Martin, can I ask you what A levels you studied?
Yeah, it's a long time ago. And I did biology, sociology, French, and law.
Okay.
So a weird combination.
Yes.
And it's not the normal combination for people to come into my profession now, I have to say that.
Obviously it got you there though, so that was fun.
Yeah, well, I suppose it was a kind of a sort of circular route, because I did a degree before coming into my current profession. So my initial degree was in anthropology.
Okay. So perhaps we can ask you to do a little mime of an aspect of your role.
Sure. Blink and you're going to miss it, but it's kind of quite an important aspect of my role. But it's a very, very simple mime. There we go.
Okay, that's going to be a tough one, I think. So has anybody got some questions then for Martin to try and figure out what his role is? Perhaps I can just ask you to start off with.
Certainly.
Is your profession 24/7, Martin?
It's 24/7, 365 days of the year. Yeah, a bit like Tom's. Yeah.
Yeah. And do you work directly with patients?
Yeah, it is literally a face-to-face role with the patient. Yeah.
Okay. Somebody's asked, do you work in a lab?
No, I do not work in a lab at all. No.
Okay. Is it related to the preparation before surgery?
It can do. There are certain aspects of my role that will involve producing something that surgeons need to perform particular surgery. So give you a clue, it's very common prior to orthopedic surgery. So prior to any surgery on bones or joints. That's a very common area of my work, but equally some of my work will also impact on general surgeons as well, and neurosurgeons and renal surgeons. So yeah, what we produce has a direct help for surgeons.
Okay. Somebody's made a guess, which could be quite similar, but I'm hoping that you might explain what the differences are between this and your role. But before we go on, then let's just ask everyone to kind of vote again to see if they can work out your profession, Martin. So, okay, so for the last time, what do we think Martin does? Okay. I think you must have explained it really well, Martin. So can you just confirm that your role?
I am indeed a diagnostic radiographer. That is my role.
Great, thank you. Now somebody, as I say, had guessed radiologist. So can you just
Okay, so
explain the
there is, yeah, there is a difference. So a radiologist must have a degree in medicine, and they then go on to do their specialist registrar training in radiology. So they will have their undergraduate medical degree of 4 or 5 years, however long that will take. And then it's approximately 4 to 5 years then postgraduate training in radiology. And that's quite new. We've got a brand new school of radiology training here in Wales, based in Bridgend. We have an academy which purely trains the radiology specialist registrars. That's a relatively new academic institution set up by the Welsh Government. Prior to that, you will find that most radiologists will either be medics, in other words, they will have specialised in medicine after they're doing their degree in medicine, or they will be surgeons by background. So I've worked with radiologists who are both medics and surgeons who have then gone into radiology. The primary role difference is that the radiologists will interpret the images that we produce as radiographers. Now that's changing slowly, and certainly my role has taken on some of the work that the radiologist would normally do. So the kind of x-rays that you'd have if you fell over, broke your leg, broke your arm, went to hospital, we would produce those images, and traditionally a doctor would then interpret those. We have now moved into that realm. So radiographers are now working in advanced practice, as I am, as a reporting radiographer. So you report the images that the doctors would normally report. And that's a sort of move forward for our profession within radiography. So I would report what we call projection images, so images of the skeleton. Some of my colleagues will report CT head scans. Some will report MRI scans. We're limited in what we report. We get trained to only report those particular areas, because ultimately we do not have a degree in medicine. So we don't have that full rounded experience of understanding the sort of medical aspects of the patient, their physiology, the way in which their pathology is affecting their body in a wider aspect. But you learn that for your specific area of advanced practice.
Okay. So as you've taken on this extra role, did you have to do further training to be able to do that? Yeah, certainly.
So you have to go back to university and take on, do an additional MSc, and you have to be able to report your images to the same standard that a radiologist would do. So we sit the same reporting exams for that particular area that a radiologist would do. So the exams that I sat are exactly the same ones that a radiologist with a degree in medicine would sit for their skeletal imaging, and we have to pass at the same rate as well. So it's a 99% pass rate. So you have to get 99 out of 100 cases right, otherwise you don't pass. Yeah.
Can you resit if you don't get it first time?
You can resit. You can only resit once, but you can resit. Yes. Yeah.
Okay. So how did you initially get, into your role as a radiographer?
Okay, so I wanted to have a profession that combined health, but also with technical aspects. So very much my role is direct patient contact, but also I'm using equipment that is worth, you know, millions of pounds. A CT scanner, an MRI scanner are incredibly expensive pieces of kit. And also it's the kind of role that brings you into contact with a massive range of patients of all ages. So my colleagues who are sonographers are scanning babies that are not even born yet, and we then work to patients right, unfortunately, to the point that they pass away. So it's an incredibly varied profession. One thing that's very different for my profession to a lot of other what I call allied health professions like physiotherapy and occupational therapy is that our relationship with the patient is very short. So to have a CT scan or an MRI scan, you know, MR sometimes might take up to 15-20 minutes, but that may be the first and only time that you ever see that patient. So our interaction is very limited with patients in that sense, as opposed to other professions that build up a long-term professional relationship with their patients. My colleagues who are therapeutic radiographers, a completely different degree, we share the same title, but it's a completely different role. They will work purely with patients who have cancer, and they will be able to develop a much longer relationship with their patients.
Okay. So what's the best bit about your role, would you say?
A variety. You know, whether you work in CT, in MRI, in ultrasound, or for me working in sort of an ED set, an emergency department setting, you don't know what's going to come through the door next. You could have a day of all minor injuries, and then the next day could be, you know, something similar to what Tom was dealing with, and probably one of the very first professions that the patients that Tom has retrieved from the scene of an accident, we're probably one of the first professions those patients will see once they arrive in the hospital, because the trauma team, the medics, the surgeons will want to know what's going on inside the patient's body, because they need that to plan how we're going to keep this patient alive, how we're going to give this patient surgery. So those patients who are severely injured will come straight to CT, where we will literally scan them head to toe to identify what those major trauma issues are and what needs prioritizing. So if we see that a big blood vessel is bleeding blood, that needs fixing. Whereas if they've broken their arm, well, actually that can kind of wait a bit, because we need to fix that big blood vessel that's bleeding. So CT allows the surgeons to prioritize the care of the patient.
Okay. And what about the worst bit? What's your least favourite?
The worst bit is it is a 24-hour job. So you have to work around the 24-hour clock. Most hospitals, sort of since COVID, will have more than one radiographer working at night. But certainly in some hospitals, you might be the only radiographer on at night. And that can get a bit lonely sometimes. But it is a 24-hour job, and you've got to be prepared for that. So I think very similar to Tom, the long hours, you get tired quite easily. So that's probably the worst bit of the job, I think.
Okay, great. Well, we don't have any further questions, and I'm aware we've kind of run over a little bit, so apologies, Martin.
No worries, it's fine.
But thank you very much. I'd just like to thank you, and I know Lisa's still on the call, so thanks very much to both of you for joining us today, and hopefully you've opened up our attendees' eyes as to some different kind of roles that they may not have considered before in health. So and if anybody has any questions, you know, they can email me, and I can always forward them on to you guys if you don't mind answering anything after the event. Great, thank you.